Hi, this is Dr. Renee Gasgarth, and I'm excited to be here for another episode of For Your Best Self podcast. I'm a plastic surgeon with dermatology plus plastic surgery, and I'm here to talk to you about MyEllevate, which you may know as the Zoom lift. So I have to preface this with saying that there are very few things that are minimally invasive that can really impress plastic surgeons. And Dr. Novo and myself were very impressed with this procedure. And we're so excited to be introducing it to the office. I think that when you're talking about what's changed in COVID life, we're doing a lot more meetings online. And we're doing a lot more interacting with friends and family via Zoom or using FaceTime. And so we're looking at ourselves in kind of a different way. And one of the biggest growing areas of plastic surgery has really been facial rejuvenation. But the reality is that we don't all have the time or want to undergo general anesthesia for a face and neck lift. So we see quite often patients coming into the office to just discuss what their options are. And before this, when someone complained about what their neck looked like, we didn't always have a lot of great options. So I always talk to people, there's sort of three parts of an aging neck. And those three things are one, skin. So as we get older, our skin loses elasticity, we don't have as much collagen, and we get some just basic sagging. And a lot of people think when they're looking at their neck that that's what it is, it's just skin. But deeper to the skin is often other problem areas. So really, your eyes and your neck are very genetic. And I always tell people that. If you feel like you have a turkey neck, someone in your family has that exact same neck. And almost always people will be like, my dad has that. My mom gave me that. So your family gives you lots of great things, but sometimes they don't give us a really great sharp neckline. And that can be, again, for various reasons, but it's usually not skin alone. It's usually there's some fullness or fat. We all have a little teaspoon of fat here, but some people just tend to collect fat more there. And so what I tell people is if that you're dieting and losing exercise, but you've always just felt since basically puberty or teenage years, you had a little bit of fullness there, that really is a genetic predisposition. And there are some cultures that are also more predisposed to having that. So that's really hard to change without what we were doing before is medical treatment for that. And so we were talking about things like liposuction, or we were talking about some of the ways to either freeze the fat, things like true sculpting or cool sculpting, or we were talking about things like Kybella, which is actually an enzyme that breaks down the cell membrane. And so those fat cells then basically die, they release their fat contents, and they come out through your body, your lymphatics take it up and naturally process it. But so we were finding that some patients, when we treated this fat minimally invasively, looked worse. And they were usually not treated by plastic surgeons who know how to look for, how much skin laxity you have and what kind of muscle structures like, but they were often treated by practitioners who weren't really familiar with what a face and neck lift does. They didn't really understand the anatomy of the area. And so patients would come after that sometimes and say, my neck looks worse. Now I have these bands here. Now my skin is hanging, and what can be done for that? And so the bands are really what MyEllevate was initially designed to address. And everybody has neck muscles. They're called the platysma, and they're actually in continuity with your muscles of facial expression. So there are those muscles when you grimace that kind of stick out here. And over time, they sag. And so if you start to think about it, sometimes you've seen someone who's very thin. They don't have submental fullness. They don't have the fat there, but you see that they almost look like there's two ropes that are pulling away from their neck. And that is what we call platysmal banding. So you've now gotten a mini aesthetic idea of how to analyze all your friends and neighbors. No, don't do that. But the idea is that having this sort of aging neck isn't one thing. It never was. And there were various ways to address it. But we didn't really have a great way for dealing with the platysmal bands. And so we've tried things like neurotoxins, especially Botox, but most patients need 50 to 70 units in their lower face every 3 to 4 months, which can be quite expensive, and they come back. And then we found that even with surgery itself, in the best of hands, face and neck lift experts will lecture on how do you prevent these platysmal bands from coming back. So I had the privilege of learning from Dr. Stuzen in Miami, and he actually was the one who introduced me to my fellowship director, the now late Dr. Mark Hodner. And they both had a very aggressive treatment for platysmal bands in the operating room, which I've adapted. And essentially, I'm removing actually part of the platysmal muscle low, and then I'm raising flaps and suturing that platysmal back together. And even with all of that, in 5 to 10 years, those bands tend to come back. So this is a frustrating problem for plastic surgeons, because then to really redo that surgery, you need essentially the same incisions as a face and neck lift. So now I've said too much information about necks, but basically what I want you to understand is that aging neck is really 3 things. Again, it's skin, it's the muscle itself, and it's the fat. And our only really way to address all 3 of those things with pretty predictable results was a face and neck lift. But that doesn't mean that everyone wants one of those, and it doesn't mean that everyone won't have problems with these bands in the future. So MyEllevate was developed approximately 10 years ago, and it was developed by a person who does a lot of primary face and neck lifts. And same thing was happening. Sometimes patients were on the borderline. So yes, they were having these platysmal bandings. They had a little bit of fat underneath their neck, but overall their jawline was pretty good. And so these aren't people that, if you weren't an actress or a model, that traditionally would have had a face or neck lift when they're 40 years old. Because again, that's potentially a 6 to 8 hour surgery. You have drains overnight. 10 to 15 years ago, people were still spending the night in the hospitals. This is really, felt like a major surgery to people. There's lots of incisions, and all of these need time and space to heal. And there's a lot more variables in how someone heals when you're dealing with these larger surgeries. So you may have heard of things called thread lifts, and essentially these were little tiny barbed sutures that were placed in various depthness without really any scientific way of evaluating placement, depth, and they really weren't meant to be permanent. But this MyEllevate, essentially the plastic surgeon said, I know this anatomy, I know what I'm doing in the operating room, and I know where exactly I want to place these permanent sutures. And I also know enough about suture material itself that these small absorbable sutures just aren't going to do it. So he developed essentially a light-guided system that helps you place the sutures at the right depth, helps you divide the platysmal bands, and helps you resuspend the sutures to the kind of the hardiest area of fascia on your neck, which is behind your ears, the mastoid fascia. And, you can say all these things and you're like, well, that sounds good, right? Sounds like it should make sense and it should be pretty straightforward. But then you see the results, and they really are wow results. So again, very few things that I've gone to a training session or seen someone talk or seen someone's actual live on the table results and been like, wow, this is really great. This is one of those wow things. So when we started learning about this and hearing about it, of course, what we wanted to know was, one, is it safe? And so this is a surgical procedure. It's minimally invasive. There are 3 small incisions, 1 below your chin and 2 by your earlobes. And then there are little pinpoint incisions as well. So anytime that you're going to make an incision, you need to make sure that the patient's going to be able to heal that. So this is still not recommended for smokers or patients who have a lot of wound healing problems. We are going to be placing permanent sutures, and they're going to stay. So there's always a small risk of things like infection or that your body has a negative reaction to the suture material and extrude it. So when we were interested in this technology, one of the things we wanted to know is, well, what happens if this is my patient? Because in a general, a face and neck lift doesn't have to be done with permanent sutures. So they've really collected good data to show that this really is a safe procedure, that patients, as long as there's a sterile prep, which again, as surgeons, we treat this like we're in the operating room and we're doing a breast implant, essentially like a breast augmentation. So there are antibiotics, there are topical dressings, and then we do suture the incisions closed. Not everyone does that. But what it means is that you basically can get a neck lift in essentially 1 to 2 hours in the office. And you don't have that same kind of recovery feeling. You don't have the same risk of hematoma or bleeding or problems with wound healing. And it just feels easier on your body because you're not having all of this anesthesia or big recovery time. And so, again, it was pretty exciting for us. So we liked the fact that it's very safe. We liked the fact that MyEllevate also is really particular. All physicians who want to do this need to be trained. So that means there's online courses, and then there's actually someone comes and evaluates you when you do your first MyEllevate and make sure that you're safe. And they don't have a problem saying if someone's not careful or not safe that they need to do it again. So of course, Dr. Nova and I passed it because we are those kind of personalities and we studied, probably over prepared for it. But we were both really pleasantly surprised by how good the patients looked and how well they did afterwards. They didn't need narcotic pain medicine. They weren't in a ton of discomfort. The skin, bruising, swelling all went down fairly quickly. And so these are all ways to tell people, like, this really is a surgery that most people can do comfortably and literally go back to work the next day. And there just aren't a lot of surgeries that I can tell people that that's true. Having said that, I always tell people there is downtime for everything. So if you want a great result, you're going to have to put in a little work after surgery. And most patients do need some liposuction done at the same time. That's just the reality to help really contour the neck, especially if you have a little bit of extra fat along your jawline, something we call jowls, or that little bit of teaspoon of fat under there. And then we also don't want those muscles that we've basically redraped with permanent suture to be able to grow back together how they were before. So for at least 7 days, you're going to be in a neck strap, which is, let me tell you, very sexy, I know. But we have had people go back to work with it, and you're definitely going to get some questions. And then you're also in a soft collar. So yes, think like you've been in a motorcycle accident, not actually hurt, but you want sympathy. Yes, those soft collars, that's what we're talking about. And you're going to do that for at least 10 days. So I don't like to tell my patients that there's no downtime, because what I'll tell you is that if you want this result to be awesome and to be great, then the better you help your skin redrape, the better you prevent a complication like fluid collecting or bleeding, and the better you allow that muscle to heal, then you will have a better result. So we're really talking about sort of 10 days, depending again on how much liposuction was done and if it's combined with other technologies such as Renuvion, which is radio frequency used to tighten the skin. We're really talking about 10 days of downtime. But if you had, for example, an event, so on the 7th day, you wanted to go to, we were talking about real estate markets blowing up here. So you really need to go see this house because you're not going to get the property that you want to buy if you don't go see it in person. You can take off your neckband and you can take off the soft collar. You just want to hold your neck straight. Try not to do a lot of bending, twisting, anything that's kind of looking down. And then absolutely, you can go ahead and take that off, do what you need to do, and put it back on. So it's not the kind of thing where you have drains, you're going to have a lot of incisions that you have to care for. It's really just about trying to, again, redrape your skin so it's nice and smooth and even, and then also protect the repair so that your neck stays nice and long and all that muscle that's been redraped heals beautifully. And so in just kind of talking about what you can expect, the ideal candidates really should have an evaluation in person. It's hard to know, to really test your skin laxity and how much fat is there, and also really evaluate those muscle bands to platysmal bands without seeing you in person. And we want to really address all of those three things if we need to. So some patients, I will tell them, you really are not a candidate for this alone. You're either going to need a small skin pinch, meaning incisions where you basically have to lift a little bit of the skin from the face, or you're going to need skin tightening with something like Renuvion, which again is a device that is radio frequency. So it stimulates your body to make its own collagen. How much response you get is always a little bit unpredictable between patients, but most patients can expect to see some nice skin tightening and skin shrinking. And so that's a great option if you have just a little bit of skin laxity. If your skin quality is just not great, then we may be talking about laser resurfacing. So if you just have a ton of little fine lines, that kind of papery, crinkly skin, then you may need something like laser resurfacing done as well. And then almost all patients, what we're seeing now is do need some liposuction. Unfortunately, there's just a little pocket underneath here that will almost look more obvious when those bands are no longer hanging, because you probably didn't notice them if the bands were pulling things out. And then we're also excited that some patients have already had a face or neck lift and are seeing a little bit of recurrence of those platysmal bands, or they had some fullness underneath their jaw that's actually their submandibular glands. So believe it or not, you have salivary glands that sit underneath your neck, and some plastic surgeons do partially remove them. What I will tell you is that removing something that you need in your body for cosmetic reasons may not be the best idea. So I don't personally do that. Dr. Nova does not personally do that. We do know some great surgeons who do, but we can use this MyEllevate technology to, instead of removing part of your salivary gland, again, things that make saliva for eating, we can redrape it and sort of lift them with the MyEllevate. So that's good for patients who really just want a super sharp neck contour and perhaps already had a face and neck lift and didn't get that quite kind of precision chiseled jaw that they were looking for. And then really anyone who's kind of noticing that their neck just isn't quite as sharp as it used to be, it's best probably to see someone who's trained in all of the areas so they can talk to you about those things, about the skin, about the fat, about the muscle, and really give you your options. I will say that in the last week, I've seen 2 patients who came in and were really interested in this MyEllevate, and they just flat out needed a full face and neck lift. There is a point when the results that we're going to be able to get are just not going to be what the patient wants. It doesn't replace surgery. Once there's so much excess skin, the risk and benefits of doing this procedure is just going to give you almost like bunchy skin, and it could make your face, in contrast to your neck, which looks awesome, your face could actually hang over your neck a little bit. Again, not a hot look, not something we want to advertise or have people walking around and saying like, oh, guess who did my neck? The whole goal is for people to think like, you look great. Did you lose weight? You know, that's the ideal plastic surgery. You look refreshed. Were you on vacation? Oh, have you been dieting and exercising? You just look happier. You look more relaxed. This is what we want our patients to say when they see themselves in the mirror. I look like myself, but the younger, happier, more refreshed version. And we want your friends and family, again, to notice that there's something subtle that you look better, but without sort of knowing what was done or what part of the body was worked on. And so I think that this is really an interesting technology. It can be combined with traditional face and neck lifts. It can be done alone, or it can be done with other things like liposuction, and that can be done in the office as well, just with a little bit of numbing medicine, or we can combine it with some of the skin tightening procedures, or with even a little bit of direct excision of excess skin. And so I think the bottom line is that Dr. Nova and I are really excited about this, and there aren't very many things, again, that a plastic surgeon who likes to operate, who likes to do face and neck lifts, actually says, like, you know what, this minimally invasive procedure is great for some patients, and I actually would choose this over doing a traditional face and neck lift for some patients, which I think is basically the highest level of 2 thumbs up that a plastic surgeon can give for a less invasive procedure. And then just with that, again, so if you're interested in having this done, we do want people to be off of blood thinners for at least 2 weeks. We want you to be at for the most part, your baseline weight. If you're having a lot of fluctuations and your neck is changing a lot, we don't want to over remove fat. We don't want to leave too much behind. So if you can kind of get, within 5 to 10 pounds of where your weight is normally going to be, that gives us the best idea of exactly what we need to do to really contour and improve your neck. And we want you to not be smoking. That's so important. So important. People think like, oh, what's the big deal if I have a cigarette here or there? But again, we're putting in a permanent suture into your body that's supposed to last the rest of your life. Getting infected is not going to be fun. It can be removed, but you basically have just gone through this procedure. You're not going to get the result you want, and you potentially then are going to have to be on antibiotics. You may need wound care. So if you're smoking, stop smoking. You can save your money. You can go on an awesome vacation. You can treat yourself with a great book or a massage, or you can come and talk to us about MyEllevate. But that's definitely really important. And then again, the post-op instructions for my patients, I do give most of them a medicine called Ativan 30 minutes prior to the procedure, just to make the numbing injections more comfortable, help you relax, not feel anxious about it. And so I do ask you to have a driver. You want to wear comfortable clothing, so you want to be able to slip on and off your shoes. Again, you're not going to be bending down. And a button-up shirt is the best thing to do. You want to come in with your hair clean and no makeup on. And then afterwards, you're going to go home. You'll have some what we call ABD pads, so a little bit of dressing. Then you'll have your neck strap that goes over your head, and then you'll have your soft collar. And you're going to sleep on 3 pillows, slightly elevated, no NSAID, so no ibuprofen, no aspirin for 2 weeks afterwards. You will get a little bit of an antibiotic to take. And then the next day you can shower. You can, take it off, get things wet, shower, and then you'll just put it back on. And essentially you'll feel like there's a little compression. Most patients aren't going to want to do big, don't do a podcast right afterwards where you're talking a lot, because things that really move your jaw, or like eating steak, things like that, that's where you're going to feel how tight your neck is. So you just kind of want to take it easy for that 10 days. And the recovery, though, you'll see an improvement immediately after, so on day 1, and you'll see an even better improvement at 7 days. And if you combine it with something like Renuvion, the skin tightening, or liposuction, your results will be even better at 3 months. So again, this is a really great technology. It's not for everyone, but it's really, for most people, can give an improvement, especially younger patients who are worried about their neck, or for patients who've already had a face or neck lift and just didn't get quite the result they wanted, but don't want to do another face or neck lift. So this is Renee Gasgarth, and again, I'm here with Dermatology Plus Plastic Surgery, the For Your Best Self podcast. I hope I gave you some interesting information and things to think about. We do have a link on our website that's going to have before and after pictures and more information about the procedure itself. And of course, we're always happy to talk to you in person and answer any questions you have, and to talk about if you're a good candidate for this. So please, we look forward to seeing you in the office, and you can always contact us via email at foryourbestself@gmail.com as well. Have a great day.